The next time you look at the clock, if it's 10:01, move, change positions. Then it's 11:59. So anytime you see that hour change, do something. Don't get reaching in place, lifting your arms in the air, standing up. There's lots of options. Just move.
Welcome everyone to the Stronger for Today show, brought to you by Method3 Fitness, where we interview and connect with Bay Area leaders to elevate the health and wellness of our community and help them live stronger for today. I'm joined with Amy, physical therapist. Amy, can you pronounce your last name for me again, because I don't want to mess it up?
Seghi.
Amy Seghi, physical therapist. And I'm excited to have her to connect today. We at Method3, we love empowering our partners, that's what we call our clients, to live stronger for today. And so an aspect of that is what we do with them in the studio, all of their, fitness and strength and conditioning and things like that. But like so many of us, we have these ailments that will restrict us from the activities and things that we like to do, that we love and enjoy, including our fitness. And we had been searching for someone to connect with on the physical therapy route that we would really, know, like, and trust, and be able to say, hey, go see this person. And so it was quite fortuitous to have our paths cross. And I think what I love most is kind of, there were a couple different physical therapists we were connecting with and trying to almost interview, so to speak, to have our go-to, right, for the studio. And I remember vividly coming down, because, I don't live, as you know, close to the studio right now, is coming down, scheduling a time to meet, and then having a brief chit chat, and then kind of saying, okay, well, I'm having some problems with my knee, so take me through what this 15-minute assessment looks like. And you're like, okay. And he just jumped right in. And I absolutely loved it. It was almost just like this trial by fire a little bit of let's just see how she interacts, and what's the bedside manner look like. And I was honestly so thrilled. I was very impressed, and it was awesome. It was a fantastic assessment. I walked away with value that I felt from even just 15 minutes with you. And it made me excited to figure out okay, I don't live here. How do I get back down here to see Amy, for myself, selfishly, and then obviously, connecting with other partners. So
that was fun.
Anyway, yes, it was. Thrilled to have you, and thank you for connecting with us. So what I actually would love to know is, how did you land on physical therapy? What was your route to get to, this is what I want to do to serve people?
Great question. So 8th grade, so long time ago.
Yes.
We had to do a career report, and I knew I was just always wanting to help people. It was kind of my passion. I was playing sports, active, and was actually a gymnast, even though I'm super tall now. I grew out of that, but I also played soccer and basketball. Was a very active child. And so I was like, how do you kind of had passion. So I want to stay active. I want to help people. What does that mean? So as I started doing research, back in the day, encyclopedias and,
Love those. Love that Britannica.
So I found physical therapy, and I was like, oh my gosh, that sounds great. So I did a career report, 8th grade. And then fast forward, freshman and sophomore year of high school, I was playing soccer and basketball, and ended up with a severe ankle injury to back in soccer and in basketball. So as soon as I recovered from my soccer season, I did it again, basketball. And so I was going through physical therapy myself, and I established a great relationship with my therapist, and I was like, this is awesome. So it kind of led me on that path. And then when I was applying to colleges, there was a direct entry program. So you could apply as a incoming freshman to the PT program, which at that time was a master's turned into a doctorate. So I got accepted into the direct entry PT program, and also a pre-med school. So, but then
awesome.
So long story short.
Yeah.
Yep.
And so how long have you been practicing then?
It'll be 20 years this year.
Oh, that is awesome. That is so great. And you've got a little bit of a different flair, right? I think most people's experience with physical therapists, I don't want to say most people, I'm going to say many people's experience is, I injure myself, I go to the doctor, they give me some type of referral, have X number of sessions, I go see the PT, maybe in a clinic, maybe in and around the hospital itself. And it's kind of just this, thing that goes like this. And yours is a little different. So can you speak to that? Because you're traveling, and I would like to say also that you're a little bit more, at least my experience, because I've had kind of a lot of different injuries throughout my life. So I've seen quite a few physical therapists. And My experience with you is, for lack of a better term, I felt like it was very proactive in this. Hey, we're going to assess this, figure out what we need to do. We'll move at the pace we can with your body, but my goal is similar to yours, is to get you back to what you're doing
Yeah.
as quickly as is safe, right? Is what I
Yeah.
experienced. So, can you kind of
Yeah.
share a little bit about how you're different?
Yeah. So, my mobile concierge practice is a little bit different, kind of stemmed off of years of friends and family asking me at birthday parties and holidays to, hey, Amy, my knee
Yeah.
is bothering me, or, I've been feeling this weird thing, and I just could never say no. I hate to see people in pain. So, and for me, it's usually a pretty easy assessment, like your experience with the 15 minutes. I can find out a lot in a short amount of time based on my, years of experience. So that kind of turned into my husband being like, why don't you do this? Like, why don't you make this into like a real thing? And I'm
A
like, I
thing.
don't know how to do that. And the business aspect was more what was the scary part for me.
Sure.
So I started doing more research. And so how I'm different is that, I don't require, so California, many states across the country, you can do direct access physical therapies. So you don't require a doctor's referral for the first 12 visits and or 45 days. So the field of physical therapy is moving more towards proactiveness, from the profession, because we know, in the name of my practice, movement is medicine. If you address things sooner, it's less likely to lead to more chronic illness and, sedentary lifestyles and people not being able to do things that they want to do. So how I'm different is people can contact me, I can do an assessment and then treat for a while before we need a physician's referral, or you might not need imaging yet, things that we could do to make things better without all the extra layers of the medical system, which is often a lot limiting. So like you said, by the time you go to the doctor, they assess you generally, if they even put their hands on you, get an x-ray, that shows nothing. Then, okay, come back, your x-ray showed nothing. And then it's by the time you actually see a therapist, it's like 4 to 6 weeks down the road. Whereas if you come to, a provider like me, we are already 4 to 6 weeks into probably making you better. And it really reduced the cost of your overall care. So,
Yeah.
and improve your quality of life, right? Because you want to go back to the gym or lift up your grandchild or your children, or go
Yes.
for a walk with your dog, or lift your groceries into the car. Yeah.
Yeah, it's so fantastic. And as a mobile concierge, many times you're going to see them where they are, correct?
Yeah. Yeah. So I think, go ahead.
I was just gonna say, I think that besides eliminating a lot of the red tape that just unfortunately we many times will experience within the healthcare system,
Yeah.
you're also reducing the amount of time. You're reducing the complexity is not the right word, but I guess just like ability to get it done. Barriers. You're eliminating more barriers, right? Because now
Yeah.
it's like, well, I have to go see you. Where are you at? Is it convenient? Not convenient? Oh, you're going to come see me. Oh, okay. Okay,
Yeah.
great. Well, then, yeah, let's schedule. Right. So it helps people make the decision. I feel like, I'll bet, because that they know they need to make for themselves anyway. So that's awesome.
Our time is so valuable, right? And so I feel like we don't make time for ourselves. We're busy in
I
our
agree.
work and our family life. And if I can, living in the area that we live in, there's a lot of people that are, well, we're all busy, but, it's like people put a lot of their job and their family first and themselves last. So, I've had conversations with several of my patients, friends, and family, and they're like, so I can schedule my appointment with you, finish a meeting 5 minutes before. Oftentimes I'll come to a patient's house, they're finishing their work. I'm like, let me set up, you finish, we'll be ready. And then we're done. They go off, I finish cleaning, and I'm out. So
Yeah.
it's like just the 45 minutes or an hour that our session is versus them leaving a half hour before to get to the appointment, half hour back, and then it's 2 to 2.5 hours out of their day
Yeah.
versus just our session.
Right.
And then on top of that, it's really difficult when I have a patient who feeds her dog. She's got 4 little small dogs. And so I'm like, okay. And so you think about that in like a clinic setting. Oh,
Yeah.
let's just do some squats, functional squats. Let's do this. but actually seeing it in her home. She has 4 of them. And so she feeds them all in their crates. So it wasn't just a squat down, it was a squat and forward reach. So we really had to problem solve that specifically. And when you feed your animals twice a day, 4 of them, that's it.
Yeah.
That's a lot, right?
That is a lot.
So
Yeah.
it's not just doing 10 squats at a clinic. Let's hold this bowl and do it this way and find the right positioning to have you be pain-free, and then work to strengthen that through an exercise.
That's pretty neat.
Yeah.
Something that you get to experience, obviously, that not the other clinicians would, right?
No.
Just because of the nature of it. So
Yeah.
that's really cool. Yeah. I was just laughing as I also was thinking to myself, as you said in the beginning there, you can't help it. You like to see people in pain. How many different, dinner parties, family events, things like that, where all of a sudden you blink and it's like there's a line of people behind, like Amy sitting down trying to enjoy something. And then it's like there's 7 people that are kind of lined up, like talking amongst each other, waiting to see you. That was just what threw my head.
He's like, where have you been for the last hour? And I was like, yeah, like, sorry. Like, she was miserable. And he was like, are you kidding? And I was like, I could, it just.
Hey, I hear you. I mean, many times I feel like we're cut from the same cloth in that, I won't necessarily, sometimes it'll be diving into health and fitness, but other times it's just literally asking about other people and connecting.
Yeah.
And I enjoy doing it. And my wife will literally say the same thing when we're out of places. Like, where did you just go? Like, what have you been doing for the last? She goes like, I literally need to pull you out of conversations because you lose track of where you are. I'm like, that's totally fair. That's
passion.
fair. But I'm here. That's what it is. Yeah, it's passion. That's what I'm going to tell her next time. It's just the passion.
I love it.
Oh, I'd love to hear, I'm sure you have many, but about like 1 or 2 of your favorite client success stories, like the people that come to mind pretty quickly that you're like, and you can say person or, man or woman if you don't want to say the names or whatever, but I'm sure you have a few. I'd love to hear what they came in to see you for, kind of where they were at and what you were able to do to help get them to, just a totally different, place with their health.
Oh man, that is so broad. Well, I mean, so career-wise, I've seen, here's my dog is like, what can we play?
I want attention too. Yeah.
Yeah. Gosh, that's so broad. Well, one person to mind currently that's been, in my mind, a huge success in how my practice setting works at this point is she was born blind. And she has significant congenital, born with progressive scoliosis and multiple deformities, musculoskeletal deformities, a lot of pain over the years. And as she's aging, she's only in her 40s, right? But, a lot of pain, and has seen a lot of different therapists over the years. And kind of similar to you, she called and vetted me one day and was like, can we just meet? I've had a lot of therapy in the past and, nothing's really worked for me, but I'm still miserable, So we had a conversation on the phone, and then I went to meet her and did a brief assessment just to kind of give her some idea of what maybe I could offer to her that was different. It's been such a lovely relationship with her because she doesn't have to go outside of her home, right? So she doesn't drive, right? She has to navigate her own space. To teach her to do exercises, all tactile, like all hands-on and verbal, right? I can't demonstrate anything to her because she can't see. And we've been able to really pinpoint areas of pain. Can I change her scoliosis? Can I change her deformities? No, I can't. But I can help her to mobilize things that help her to have less pain.
Yeah.
And for a lot of us, that's success, right?
Absolutely.
So we can, the cards that we're dealt, we can't always change. Or if we have a progressive disorder, we can't change that necessarily, but we can change how we manage that. So giving her tools specifically in her home environment has been life-altering for her. And so
that's amazing.
She's found that she's able to have less pain. But there's days that she does have more pain, but at least it gives her, and she's told me, you give me hope,
Wow.
She's like, I know I'm not perfect and I'm never going to change this, but you give me hope that I can have a better day. And it's just, that's why I do this.
Yeah. Yeah.
So it's not like I was able to, make a huge change in her overall mobility. I mean, yes, but I have. So she has a big leg length difference because of the scoliosis and deformities. So we trialed different heights of her shoe lift to make her more level. And it takes a lot of patience and working with somebody in their own space to do that. So yeah, I would say she's probably one of my most rewarding patients presently. Yeah.
That's awesome. That's awesome. I mean, and I think that's what a blessing for that person, to be quite honest, right? I mean, I think that's
Yeah.
where many people are at. Like there's in so many different facets, right? There's so many different fitness studios and physical therapists and chiropractors and massage therapists, and sometimes it's like there's never the best experience, and sometimes that can leave people feeling untrustworthy, jaded,
Yeah.
all the above with their experiences, and then either restrict them from even moving forward to find another one, or make them so skeptical that it's hard to like reestablish a relationship. So
Yeah.
that, I think that speaks volumes to not just your experience, but probably more to your character and how you connect with them,
Yeah.
right? From a bedside manner, as they would say, right? Just
Yeah.
the words you use. We talk a lot about the
Yeah.
words we use and how they're important, but what an ability to adapt, right? I mean, you literally can't show her what to do. So one of those methods of learning just got removed, and now you're stuck with, okay, verbal and tactile. How do I get this across and still
Yeah.
make progress, right? That's
Yeah.
pretty incredible. So I'm curious, for a lot of our people that are going to be listening and watching this, they're in our 40, 45, 50 plus crew, and we definitely in Method 3 have kind of specified that these are the people we're really excited to continue to work with, because not that we don't like all people, but these ones specifically, people are understanding more and more the importance of strength training and mobility and all these different facets that now, as their kids have left the nest, so to speak, and or jobs are winding down, maybe people retire depending on where they're at, and they're realizing, wow, I got a whole lot more life to live, and I got a lot of stuff I want to do. How important it is to have these facets, these components as part of their program, right, for the overall health and wellness. And I'm curious what you have seen, right, amongst dealing with certain injuries, some of the things of where some of these things came from, right, like the quote unquote root cause of like, hey, it's your knee. I know your knee is experiencing, but man, your hips are tight, right? I think we got to unlock these bad boys, because or your low back. I hear your low back pain. I hear that. We'll talk about that. But if we can unlock your hips, which are like rigid blocks right now, so I'm curious what you've come across. And I know this is another broad question, but I'm
Yeah.
trying to think of the audience watching.
Yeah.
Is I still feel like, even as coaches here, as fitness coaches, there are still a few things that come up more often than not, right? And so, in your experience, when you're connecting with people, what are a few of the things you're like, man, I mean, top three things I see in most people, right? If they did things to unlock X, Y, or Z from a mobility perspective, things
Yeah.
would probably improve. What would those be?
Yeah. So I think this age group in particular, the 40s to 50s, you're deep in your field, your career, and yeah, you're trying looking towards retirement, but I think posture is a huge component. How you
Mm,
spend your day. Prolonged sitting is terrible for your
yeah.
body. Thinking from a hip perspective, low back perspective. I think, again, seeing people in their home space, and if they have a workstation at home, I'm at my husband's desk that he works from home currently, part time. Just based on him and initially that we really worked on his workstation, because with COVID, everybody came home and you had those terrible workstations. And so, really working on like sit stand desks, modify your positioning, looking at cushions, back supports, things like that. Because often than not, people get into this kyphotic posturing, forward head, excess thoracic kyphosis, posterior pelvic tilt, and you don't have support under your feet. If you're too short, your feet don't touch the floor. It's really getting into that 90-90 position and sitting, and working your core, right? And so I think the core stabilization component is huge, because if you're just sitting and hanging on everything all day, you're going to go to stand up. Your core's been inactive for hours,
Yeah.
and you're on a call, you're working aggressively on the computer, and you go to stand up and everything's tight, right? So our pecs get tight, hip flexors get tight.
Yeah.
Glutes are shut off because our hip flexors are so tight. So you can't use your glutes if you're not extending at your hip.
Yeah.
And core. I mean, the list goes on. So
Yeah.
I think for this population, the biggest thing
Yeah.
that I end up seeing, for people that are otherwise healthy and active, who are trying to work out and are trying to maintain an active lifestyle, but then all of a sudden they start feeling things, we can address it acutely, from a PT perspective, while going through and diagnosing where some of these impairments lie. But then as we're moving forward, that's where I dive deep into, well, how are you spending your day? What do you do? How many hours are you sitting? How many hours working or sitting on the couch with, you can rest. I mean, there's no problem with resting. You can be active and, fit all day long. I get it. But, what are your mechanics like the rest of the day? And breaking that down, I think that makes a big difference. Or when, you drop something, are you squatting to picking it up? Are you bending over, and flexing at your spine, which is terrible too. So
this is great. I mean, I think, if I had to pull some of the, I know if I just let you go, you could probably start going. And then we talk about this and that, yes, which is great. I love it, the passion. So, but I think if I had to pull a couple of things really, I mean, I'm hoping what people are hearing right now as I reflected back to you is just move throughout the day,
movement,
right? Because there you go. Oh, boom. I couldn't have teed that up better. Look at that. Okay. So that's the name of Amy's company, everyone, in case you're wondering. But yeah, I think that's so more often than not, I think, again, there's so many barriers and restrictions that people place as it relates to what does success look like with my health and wellness. And people either think all or nothing, or they think, it's got to be from 0 to 60, in 2 seconds flat. And, they forget that like a lot of what they've probably done in life was not achieved by that. It was not achieved by an all or nothing. It was not achieved overnight. And yet, as a whole, we always want the fastest, quickest fix to get better, right? So it's like, hey, I'll come see Amy. She'll solve my knee pain in a day or two. And then Amy tries to ask questions. Well, tell me about your day, right? And they're like, I mean, I just work and, I got to work, right? And you're like, yeah, but you can choose. I'm doing a standing desk right now. I use a Varidesk pretty much daily.
Yeah.
And there's small choices you can make. And when those small choices, they accumulate, right? They accumulate, they compound, and they get to where you want to go just over time.
Yeah.
So I love that because it's something that people can very simply do. I mean, so many of the smart trackers these days, I mean, it'll beep at me if I don't move, or you can set a timer every hour and walk a little bit. I mean, it's not hard to do the action, I feel like, for most people. What's hard is actually implementing the habit to begin with, right?
Habit. So when it like consistency, right? So like not the all or, people are like, oh, if I go work out like 2 hours, 1 day a week, I did it. And it's like, not really, like that's great. But what about the rest of the week? So consistency is really the key, right? So, and habits, right? Just like you're saying. So, it's the habit forming. What are the Atomic Habits? That's awesome book.
Yep. Fantastic book.
It's not hard, but it is. Change is hard. Change is difficult. So I often say, we have all the tools on our watch and things, but mostly I say, this is a piece of advice I've given to patients all over time, and family friends, is anytime you see the hour change on the clock, like, so it's 9:30 right now. The next time you look at the clock, if it's 10:01, move, change positions. Then it's 11:59. So anytime you see that hour change, do something. I don't care if it's marching in place, lifting your arms in the air, standing up, opening your chest.
Literally anything.
Just move, lift up from your chair for, there's lots of options. Just move. Yeah.
So if you had to, think about, and maybe this comes back to like the sitting thing, but let's move into the 50 plus crowd, right? So 40s, 50s, maybe same crowd. Is there any mistake that you see them kind of consistently making, or certain thing that they're failing to do that you think would benefit them so much as it relates to their overall movement improving?
Mistake. Their body mechanics. Like I said, how do you pick things up from the floor, how you carry your groceries, how you reach for something in the cabinet. So oftentimes people are, reaching with this awkward movement of their arm.
Yeah. Yeah.
And if they learn that actually that makes it go a lot easier, but if I close my chain, I can't go anywhere. Or this whole like thing with your arm and you try to lift up, well, it won't go any higher because mechanically it's
Yeah, it's
stopping.
hitting
So yeah, stop
body
Googling
mechanics.
body
Yeah, no.
mechanics, stop Googling your symptoms,
Yeah.
because that's
Well, that'll be a tough one to break, I think, for everybody right
sorry.
there. That's just now they got the AI in there. AI is going to send them down the rabbit hole.
It's so
But
bad.
I agree. But I think just those two things, right? Dr. Google. But I think the body mechanics is one that, well, I mean, honestly, yeah, they can stop searching things too quite easily. But
Yeah,
the body mechanics one is one where they can start to make very easy, subtle changes. And I think, it's one of those things that can be so hard to translate, I guess is the best
it
word I
is.
can think of right now to people in terms of, these little actions. They may seem so, you just turned your arm, right? And that's all you did. But these little things done over time, that's what I always try to keep coming back to try to
Yeah,
explain to people is that, sitting in and of itself for short periods of time isn't bad. It's the prolonged sitting over time, over hours, over days, over years,
years.
right? It's the in that posture and then gravity acting down upon you, just taking you here, 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 and you don't even realize it, right? And so I love the body mechanics thing because that's a low-hanging fruit that if people were just more mindful on one thing, how they grab, how they carry their groceries, how they squat down to get something, right? I mean, that's just something that can very easily have an impact for them. So that's
Yeah,
awesome.
yeah.
Awesome, awesome. Cool.
Yep. And you think about repetitive use injuries, right? So you think about your athletes, that's where we see it mostly, but that's also with your layperson, right? So it's how your repetitive movement patterns over time, or even as you're exercising. If you're exercising with poor mechanics repetitively over time,
Yep.
you're actually doing more damage to the joint or the surface than with better mechanics. So I think that's really optimizing your movement patterns to strengthen, to give you better functional movement, right? So functional strengthening is super important. And you guys do a lot of that at Method3. So I think that's
Yes. I mean, obviously to the best of our ability with everyone, but I think it comes back to those mechanics, the posture. And for anyone watching this, I think it elucidates the big fact on why working with a professional is so important. My wife and I joke around as we moved up here, we just take turns on who's seeing like a physical therapist at any point in time.
yeah,
Because there's always something we're kind of working on. And to be honest, right, we, even though this is like, she comes from a fitness background and coaching background as well, this is our profession and we still don't see our weak spots, our blind spots, how our body's moving in space, right? And not necessarily from the same point of view as a physical therapist would, as a different practitioner would. And so I want people to understand that kind of highlights that, like, this is why every great athlete has coaches, right? Well, hey, we can have coaches too, and that's okay. That helps us perform our best, feel our best, and you're one of those people, Amy. So grateful for you. Thank you so much for being on the show and having this awesome dialogue with me today. Appreciate it.
thank you.
If people want to, we'll put this in the show notes and everything else, but if people want to reach out, what's the best way for them to contact you or connect?
Yeah. So you can reach out. My website is mimphysicaltherapy.com. MIM stands for Movement is Medicine. Email is amy@mimphysicaltherapy.com. I'm happy to have a conversation.
Awesome. Well, thank you again, Amy. It's a pleasure, and we'll see you soon. Have a good one.
Great. Thanks, John.